Dear viewers, welcome again. We were talking about gynecological cancers as well as breast cancer with Dr. C. Hui T. So what about the treatment modalities depending on the, as you have told that,
Yes.
the treatment modality is
surgery.
dependent
Yes.
on the stages of the...
Actually, no. All stages would require to have surgery. Number two is depending on whether it's aggressive or not, they will need to have chemotherapy. If there is breast conservation surgery, they would need to have radiotherapy. And if the cancer is sensitive to female hormone or related to female hormone, they may need to have oral medication to reduce the female hormone or to reduce the risk of the cancer coming back.
Okay. Then let's talk about the other cancers. Can you please explore the common risk factors, symptoms of ovarian or endometrial cancer?
The most common risk factors for ovarian cancer is also obesity as well as family history, which means that if my mother had ovarian cancer, then the risk of myself having ovarian cancer would be 10 times compared to other ladies who do not have a family history. So ladies, viewers who are watching this, if your mother had an ovarian cancer, it's important to get regular checkup to make sure that there are no problems. Now, ovarian cancer usually is discovered quite late because early stages there are no symptoms. It is only when it's in the 3rd stage or the 4th stage, ladies will present with big bloating, they feel back pain, they feel leg pain, they feel very tired. They might also be weight loss, but again, weight loss is a very, very late stage.
Very late stage. And what about endometrial carcinoma?
Now, actually, cervical cancer is more common in Bangladesh than endometrial cancer. People do mistake between what's the difference between womb cancer, which is endometrial cancer, and cervical cancer, which is uterine cervix or at the bottom of the womb. So more common is actually the cervical cancer. Endometrial cancer is not too common in Bangladesh and in Singapore. Now, for cervical cancer in Singapore right now, it's going down to very, very low. In fact, it is probably in the next few years going to be out of the top 10, but it remains to be very common in Bangladesh. The pure reason is from screening. Cervical cancer is one of the most screenable cancers that we know in medical history, meaning that if a lady goes for pap smear once every 2 to 3 years regularly from the time that they are 20 to the time that they are 50, we can reduce the risk of actually getting cervical cancer up to 80 to 90%. So pap smear itself, there's a national program here. We check ladies every year at the beginning, followed by every 2 years once we know that there's 3 that is normal, and followed by every 3 to 5 years depending on the type of test that we do for pap smear. These tests look for very early changes which may signify infection or inflammation of the cervical cells that in the long run may become cancer. So these cells are called CIN or carcinoma in situ. If we can get these cell changes before they develop into cancer, then this whole problem is solved 100% of the time. So with successful screening programs, majority of countries have enjoyed a very low risk of cervical cancer. So, but most ladies are very fearful of doing this screen. They are embarrassed about going to see a doctor.
Is it painful or complicated process?
Actually, it's a very simple process. We used to have this bus that we have nurses going around doing pap smears. It is not painful at all. It takes less than 1 minute to do it, and it's not expensive.
Not expensive, okay. So how they actually present, the patient of cervical carcinoma, how they present?
Now, unfortunately, stage 1 or stage 2 cervical cancer may not have any signs and symptoms. It is only when it goes into a larger tumor or a later stage, they will present with pervaginal bleeding, irregular periods, pain after sexual intercourse, or bleeding after sexual intercourse. Usually when there are such a symptom, the cancer is already a little bit more advanced. Usually we consider advanced stage 1 or advanced stage 2 or even stage 3 or stage 4. In such circumstances, the treatment is more difficult than in the CIN and the cure rate is much lower.
Okay, what about the treatment modalities in case of cervical cancer?
So the very early stage where we talk about stage 1A, where there are no symptoms and can only be picked up by pap smear, is actually surgery. So is CIN. Surgery can eliminate completely the cancer and the cure rate is very high. But when we reach 1B1 or 1B2, when the tumor is larger, usually when they are beginning to have symptoms, then surgery cannot do a proper job, then we need to offer chemotherapy and radiation at the same time, followed by consideration of some more chemotherapy.
So if it is detected in earlier stages, it is completely curable?
Yes, but only if we can pick it up using pap smear, because very early stages there are no symptoms.
No symptoms?
Yes.
Okay. Is there any risk factors for getting cervical cancer? What are the risk factors?
The common questions that ladies always ask is, if I am a single lady and I don't intend to get married, and I've never had any intimate relationship with any men, do I need to have pap smear? Then the answer is no. Cervical cancer is caused by this infection called HPV, which is human papillomavirus, which is a very common infection that ladies can get, and men can get too, through just sexual intercourse. Okay. Now, there is also vaccination now that we can vaccinate our young ladies or young girls from the age of 9. It is licensed for vaccination for ladies in 9 to protect them against HPV, therefore reducing the risk of CIN or cervical cancer in the very long run. So it can be protected. So that's the main risk factors.
Main risk factors.
Yes.
Okay. Okay, doctor, we'll get to know about other cancers as well after a short break.
Yes.
Dear viewers, we are going for a short break. Stay with us.